Dr. Fatunde, I have heard that people who, let's take children, adults the same, I suppose, but anyway, let's take children who wear braces, those, metal ceramic braces, go around the teeth. Sometimes the teeth are getting straightened out after a year or two, whatever, based on the case the treatment might last. However, at that time and point, the person has some type of gum disease and has some type of very, very stained teeth around where the braces were on it, and he comes out like a zebra or some type of, and that has to do with brushing and hygiene, and as you in another video mentioned, the participation of the patient is super important. However, that problem could be avoided easier. It's a little easier avoided with the clear braces, the trays which get stick up like the Invisalign or those type of stuff, simply because they come off when eating, when brushing, and that's when they should go back. So there is no spinach flag ever waving around on it. Is there some truth to what I say, or can you shed some light on that, please?
Yes, thank you. The clear aligners are removable, so you are able to take them out and put them in, and that makes maybe a little bit easier to brush, because you can brush off whatever food is hanging around the aligners. However, it does not, wearing braces does not limit in brushing. Every patient that comes in, as we put braces on, we show them how they need to brush and how they need to pay attention to brushing. It is impossible to have a successful orthodontic treatment without a good oral hygiene. If the oral hygiene is poor, the gums are inflamed, they bleed, they hurt the patient. Oftentimes we will just have to stop treatment and send the patient to the dentist. And until the dentist clears the patient and says, okay, you can resume treatment, we are unable to. It is very, very easy to be able to brush and to floss, and extremely important that patients do that while going through orthodontics. We encourage them, we'll go over it over and over. Without a good oral hygiene, it is impossible to have a successful orthodontic treatment. So whether it's clear aligners or traditional braces or clear braces, any type of orthodontic treatment has to go together with good oral hygiene.
Okay. However, it's a little easier if you can take the stuff off. It is a little easier, right?
A little bit easier, but it's also easy to learn how to do it with braces on.
You can see I'm the lazy type of person, but not. You must understand when my wife and me go into the bathroom at night, which we since 20-some for whatever years do almost all the time at the same time, and I do my shower, I do my shaving, I do my teeth brushing. My wife is still brushing the teeth while I do all the other things. So you understand, I just try to help those guys who are or girls who are similar than me, lazy. All right.
Well, I think she's showing you a very good example. You need to spend some time to brush all aspects of the teeth.
Yeah, and it's not only in the teeth brushing. She shows me a good example. I would really be nowhere without her. So in any case, what do you think is one of the biggest advantage of those Invisaligns or those trays? What would you hand off say is one of the biggest advantage?
Aesthetics for one, because a number of adults do not really want to wear braces. A lot of them oftentimes wore braces before as young when they were younger, and either they did not wear their retainers or there's been some relapse, so they want to straighten. So they don't want to wear braces again. So aesthetics is a big advantage of it because
they really are invisible, right, or not? I mean, are they invisible? Or
they're less visible from the distance. It's hard to tell that the patient has anything on. If you get close enough, you may notice it, but you really have to be a close person to get close enough to notice it.
Normal talking distance, 5 feet, 6 feet, 8 feet, kind of like, you won't see it.
No.
Beautiful. 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 And if a person is very conscious, let's just say a 40-some years old guy, and he has this meeting, and he's conscious, or a 17-year-old girl who has her first date, and if they take that out for a couple hours, sometimes, really, is that the end of the world or not really?
Not really, but they really don't need to take it out because it's not that noticeable. They can keep it in the mouth and still do whatever they want.
Let's assume it's at the beginning and they haven't yet quite noticed that really nobody notices it, and the few who notice it, they give probably more admiration than anything else. We all give admiration to people who do something for their health or their education rather than, so to say, punishing them. But let's just assume the person is that super self-confident, and for that one time here and there, it's not the end of the world, right?
It's not, but it's not advisable because in taking it out, there is the risk of losing it. And remember, it's sequential treatment. If you lose one, you have to go back and get that done over. So it's not advisable because...
Since you mentioned the losing, if you do lose one, let's just say a 15, 18-year-old, and for that much an adult like me, you lose it, sometimes we lose our cell phone or whatever, and you step on it for some reason, kids in the school playground, can that particular one made again?
It can, but it depends on which stage of treatment. If it's really early in the treatment and you lose retainer 1, that's all that needs, to be remade. If, say, you're on retainer 4 and you lose it, definitely you can go on to 5. But depending on when you lost it and how much time or at what stage of treatment you get to the doctor, maybe retainer 3 needs to be, aligner 3 needs to be remade, but it could well be 2, 3.
I see.
So it all depends on when you lose it, how quickly you get back to your doctor, how much movement or relapse has happened, that determines how many.
So if a person loses one retainer, let's say he just wore it for 3 days, he's supposed to wear it 2 weeks, and then third day he steps on it. How long does it take him to get that back? 3 days, 5 days, 10 days?
I think depending on the lab, if you get to the doctor quickly enough, they can take a mold for that is lost and send it back. But you got to give the lab some time to fabricate and ship back. So you're looking probably at about 2 weeks turnaround. I
see. And in the meantime, one would wear the retainer from before back to number 3 or so, right?
Well, the problem is if the previous one finished its treatment and the one you lost already started moving the teeth forward. So retainer 3 may not necessarily fit the teeth at that point.
Right. So anyway, obviously you want to pay attention and you want to make sure you don't lose it and don't get into the habit of not using them. Otherwise you become like the guy who exercises and says, okay, one time is okay not doing. Next thing you know is he doesn't exercise for a whole year. I understand. So there is still an advantage in the fixed braces because they're there, that's it. You can't take them off.
Yes, from that point of view.
Yeah. Well, thank you very much, Dr. Fatunde.